The most common causes of chest pain is quite a vast topic. As you can imagine, there are many different organs and structures within the chest, and all of these can cause a problem to someone at some point in their life. Clearly, the one aspect that interests me the most, that I try to make the biggest difference in, is chest pain that comes from the heart. And this particular kind of pain is classically described as a tightness or a heaviness in your chest, which can radiate to your arm, your neck, your jaw. It's particularly worse when you exercise. And it's what we call angina, which is as a result of a lack of blood flow to the heart. But as well as heart pains, you could have pains from the chest wall. The most common causes are muscular and skeletal problems within the chest, which can cause pain. They cause symptoms. Infections can cause pain within the chest cavity. Esophageal problems can cause various problems. So the actual list is actually quite extensive. And the key to it is to try and decipher and distill out what is causing the problem. The best way of relieving chest pain at home is to first ask yourself a couple of questions. When did the pain start? How long have I had it? How bad is it? Is it associated with any other problems such as sweating, nausea, or vomiting? Is it particularly worse when you do something, when you take a deep breath, when you move your arms, or when you bend over, or after you've eaten food? And even, at a basic level, you can sort of work out what could be causing it. But clearly, if it's something that's causing a lot of pain and causing a lot of associated symptoms, such as sweating or nausea or vomiting, the best thing to do if you're worried is to have a chat with your GP or dial 111. That way we can help you make that decision as to what could be causing and best help you. But it very much depends on the cause. The other symptoms that you can experience with chest pain can be quite mixed. And I've mentioned some of them already in previous questions, but just to recap that, if it's chest pain from the heart, for example, it may be associated with nausea, vomiting, sweating, dizziness, loss of consciousness. There are a whole host of things that can occur with chest pain, particularly if it's coming from the heart. So that's what I would be particularly looking out for when I'm talking to my patients. When chest pain is a result of a heart problem, again, we're asking for specific questions. Where is the pain? When do you get the pain? Where does the pain occur? Where does the pain spread to? What else is associated with it, such as shortness of breath, nausea, vomiting, or dizziness, and profuse sweating? These are the sort of particular associated features that we're looking for. But what's also interesting and what's also important is to know what the past medical history of this patient is. Has the patient had chest pain before or heart disease before? Or is this a new occurrence? So there are lots of different ways of trying to ascertain what has caused the problem. Seeing a doctor with chest pain can sometimes be quite a challenging decision to be made. We clearly know that everyone is very busy, that the health services are all inundated, but that does not mean you shouldn't act on your symptoms. If your chest pain is severe, if it's particularly associated with certain symptoms such as nausea, vomiting, or shortness of breath, or if you have a history of heart disease or heart attacks, and if you're worried, at any point in time, that is the time you should call 111 or your GP or seek specialist advice whenever you feel you're worried about it. Well, there's a number of tests that we can carry out to try and investigate the heart. Common tests that I carry out would include coronary angiography, which is a test where we put a small tube up your wrist, feed it up to your heart, and take some X-ray pictures of the heart arteries. It is the best test to have a look at your heart arteries. It is what we call the gold standard, and it's a procedure which will set out if there's a major problem with the patient or not. So that is a common procedure that I would perform, and that would lead on to, for example, if we find a very tight narrowing in the heart artery, which we think is appropriate to treat, we may be able to treat that with tablets, or we may be able to treat it further with stents, which are essentially metal scaffolds that we place within your artery to open up the artery to make sure the heart gets a good blood supply. But clearly it depends on the degree of disease and where the disease is, because at the end of the day, if the disease is quite widespread and the patient has other factors such as diabetes, you may want to have a discussion with the patient with regard to other options, such as surgical revascularization, which is more commonly known as a coronary artery bypass graft operation.